Rubella, brought to you by Griffin Neel, Bridget LaRock, and Gillian Schultz. When somebody is infected, they are typically infected 10 days before the rash until around 2 weeks after the rash completely disappears. These rashes might initially look mild, but the rash worsens dramatically. People infected with rubella have symptoms including a high fever, headache, runny nose, puffy red eyes, aching joints, and tender lymph nodes behind the head. The single-stranded RNA virus is the only member of the genus Rubavirus, and it belongs to the Togaviridae family. This virus is highly contagious and can be spread directly from an infected person through coughing or sneezing. The rubella virus can also be transmitted vertically from pregnant women to unborn child via the bloodstream.
The rubella virus enters through the respiratory system and replicates itself both in the epithelium and the lymph nodes before sending the virus to other tissues and organs in the body. This ultimately leads to a red rash on the body. Congenital rubella syndrome, or CRS, occurs when an infected mother passes rubella congenitally to her unborn child. CRS typically takes place within the first 3 months of pregnancy and can ultimately lead to miscarriages, severe birth defects, or stillbirths. Unfortunately, there is no current treatment for CRS. Specific therapies have been created to cope with the complications associated with the child. This rubella virus is transmitted directly through droplets such as sneezing and coughing and can only occur in humans. In 2004, the U.S. declared that rubella was wiped out, and since then, there have only been about 10 cases. Undeveloped countries such as Kenya and Botswana, along with many other countries, still deal with rubella, and according to the CDC, there are over 100,000 babies around the world that are born with rubella.
The spread of rubella can be prevented by excluding infected persons from childcare, preschool, school, and work until they have made a full recovery or at the very least have waited 4 days after the beginning of their rash. The best way to prevent rubella is by getting vaccinated with the measles, mumps, and rubella (MMR) combination vaccine or by getting the measles, mumps, rubella, and varicella MMRV combination vaccine. 2 doses of this vaccine are usually enough to protect against rubella infection unless the vaccination is received after being exposed to the infection. Anyone that suspects that they have rubella should go to a doctor immediately to check the diagnosis and to inform the people that they have been in contact with that they might also be infected. In addition to general prevention, all pregnant women should be tested to check their immunity for rubella before and/or during early pregnancy. If the test comes back that you are not immune, an MMR vaccination is given after delivery of the baby but before discharge from the maternity unit. The rubella vaccine should not be given to a woman who is pregnant, and you should avoid getting pregnant for 1 month after receiving the vaccine. If you think you have rubella or have been exposed to rubella, seek a specialist's advice whether or not you have been vaccinated. Rubella reinfection may occur, often without symptoms, and can occur in individuals who have had a previous infection or vaccination. In these cases, fetal damage is rare but not unheard of, so it's best to see a doctor as soon as possible. Currently, there is no effective antiviral treatment for rubella. The symptoms can be treated by drinking plenty of fluids and taking pain relievers if necessary. Paracetamol may be used to reduce the fever and pain associated with rubella, but aspirin should not be given to a child younger than 12 unless a doctor specifically recommends it.